My name is Shari, and this is the Heavily Metalled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll.
Hello, metalheads, and welcome to the jungle. Thank you for coming back to this episode of the Heavily Metalled Podcast. Today, I am bringing you myself. I have had quite the year. There have been some developments with my health and continuing to document my story and the way things have gone for me. Part 1 and 2 of this podcast was my personal story, but there was a lot more to come, and it was relevant to the entire picture. It's relevant to metal hypersensitivity, and I think it's going to be relevant to a lot of you. So I wanted to come on and spend this time talking about what has happened since episode 1 and 2, and kind of bring you all into a bigger conversation of some common comorbidities that affect those with metal hypersensitivity and further the conversation along those areas. Back when I was telling my story, and back even when I started this podcast, it was pretty well known that when I had a fall with my Great Dane, I became so impaired that I was no longer able to sit, stand, or walk. And I had no idea that this would tie into something very specific. I thought it was just inflammation. It was just me being a wimp. I knew it wasn't just me being a wimp, but it was like I was fine one day and somebody flipped a switch and all of a sudden I wasn't fine, and just could not figure out what the problem was. Initially, I could only walk due to inflammation 5 feet to the bathroom and back. And then as time would go on, I could get a little better. Sometimes I could walk up to a quarter mile. But if I tried to do anything with any kind of consistency or regularity, I would get shooting, stabbing, and cramping pains down my legs, super heavy legs. And neurologically, my legs would even stop working. So we did find that answer, and it's just crazy how things developed. I will go back and say that the entire thing winds up starting with something that I find is very, very common in people with metal hypersensitivity. And I don't know what the correlation is. I don't know what the clinical picture is. I don't know really even yet what the research shows, but I know that there needs to be some. But we're finding a huge correlation with metal allergies in people that are hypermobile. I don't know if you know what Ehlers Danlos Syndrome is, but it's a connective tissue hypermobility disorder. And there are many different kinds of EDS or Ehlers Danlos Syndrome. I'm not a super bendy person. One of the criteria for I know hypermobile Ehlers Danlos is like you can touch your thumb to your arm. You can see that I can't do that. I'm not double jointed. I've never been able to do the splits except for one way and wasn't able to get down. I've rarely been able to bend over and touch my hands to the floor, which I always hated. I always thought as a teenager that there was something wrong with me because I didn't do that. But I can hyperextend my elbow quite a bit. And there seems to be a lot of hypermobility in my spine and in my pelvis. And I have very soft, kind of spongy skin. I don't scar much at all. Like I've had 4 or 5 surgeries to my neck and you don't even see a scar. So my connective tissue is very, very different. And things that didn't cause a lot of people to have surgery did cause me to have surgery. And I just don't heal well because of this connective tissue thing. Lo and behold, I've had to have all these fusions and nobody could figure out why. Why am I the person that has to have all these fusions? Well, it became very, very evident through a lot of different ins and outs that my spine was very hypermobile. And as I started going to therapists and working on pelvic floor and some different things to try to get my health back and get my life back, my therapist said, "Man, your hips are so hypermobile. I can't believe you have this kind of mobility for being bedridden for all of these years." And at this point, we were working on pelvic floor and some pain in my tailbone area. As it turns out, I'll put it up on the screen, but I had a very, very badly dislocated tailbone. And when I'd sit on it, instead of, it going under and curving under, it would go like this. It would dislocate 100% to the rear. It's not supposed to do that. I went to a very, very amazing doctor, Dr. Foy, who's on the staff at Rutgers University Medical Center in New Jersey, tailbonedoctor.com. Dr. Foy was amazing in helping me work up my tailbone and doing sitting and standing x-rays on my super, super hypermobile and broken tailbone. Don't know when it broke, when it dislocated like it did, but ultimately wound up being sent to a surgeon to have my coccyx removed, which is the tailbone. Not very many people do this surgery, and I would say even less do it well. So when I knew that the injections pinpointed the cause of some of my pain, and I'm still trying to get to why I can't walk, sit, or stand, when those injections got to the source of the area of that pain, and it was determined that the amount of relief I got from the steroid injection at that hypermobile sacrococcygeal junction and that coccyx area wasn't going to last more than a few months. That's just not sustainable to get a steroid injection there every few months. And that's just no quality of life. So we decided it might be best to have my tailbone removed. And so I located Dr. Schroet through a website called coccyx.com. Dr. Rudolf Schroet is the chair of neurosurgery at Sutter Health in Sacramento, California. Incredible, incredible doctor. And he was known for doing the largest coccygectomy trial in the US, and he's done hundreds and hundreds of coccygectomies, had really, really favorable reviews. So I began my few-month process to get on with Dr. Schroet. We had a virtual consultation, and that went very well. And he looked at my x-rays, and we decided, in the absence of anything else that could keep me from walking, sitting, and standing, and I had gone to extreme measures. Let me tell you, I bought a purple mattress, which I will never sleep on anything else, because sitting or sleeping on anything that was too hard or too soft, it just wasn't even feasible for me. So basically, I had to stand a lot throughout all this massive 10-year time period. And I bought a $10,000 couch. Don't laugh. No, I don't have a spare $10,000, but I had to have this couch custom made with memory foam. I couldn't sit or lay on anything else. It was just too incredibly painful. Here I've had my pelvic floor therapy. I've had my SI joints fused. I've had them fixed. I'm still having all this pain. I still can't walk more than a quarter mile in an entire day. And I look fine. And my imaging is fine, right? So anyway, thank God for Dr. Schroet. We go out. I have my coccyx removed. The surgery, thankfully, was flawless, but it came to my attention after I found Dr. Schroet and had that surgery. And I did get a little better, but I still was not able to walk long distances. I could sit better after about 4 or 5 months, because having your tailbone removed is not a super comfortable surgery, as you can imagine. So it came to my attention when I was working with Dr. Schroet that Dr. Schroet was rock star famous for something called Tarlov Cyst surgery. And so, just being curious, I have to know what a Tarlov cyst is. So I look it up and I find out that a Tarlov cyst usually can appear anywhere on the spine, and does, but it is common to people with connective tissue diseases. Here's that connective tissue disease link again. And find out that it's common to patients with connective tissue diseases. And these are cysts that are most commonly on the nerve roots of the sacrum. And they're thought by many doctors and radiologists to be an incidental finding. They're thought not to be symptomatic, but due to Dr. Schroet's research and the research of other surgeons like Dr. Frank Feigenbaum, and there's also a doctor named Dr. Welch somewhere else in the middle of the U.S. These surgeons, I believe, are the surgeons recommended by the Tarlov Cyst Society of America, but they have found out, these great surgeons, that these Tarlov cysts, in fact, do become symptomatic after trauma, after a fall, sometimes after childbirth, and they cause, guess what? every symptom that I was experiencing. So it turns out I had my MRI reread, and I did have a very small Tarlov cyst on both sides of my sacrum at the S2 nerve root, less than 1 centimeter each. I'll put the report up here for you to see it, and I think I have an image here that I can also put up. But these very, very little cysts that are thought to be incidental, turns out can cause the sacral pain, can cause the disability that makes you able to not sit or stand or walk. And I wound up consulting with Dr. Schroet on my Tarlov cysts, and he thought it was very probable that this was the answer. Remember, I had this fall with this Great Dane, and all of a sudden after that, couldn't walk, sit, or stand. And nobody knew why, because all the imaging and all my therapies, everything looked spot on normal, except for this Tarlov cyst that the radiologist identified. It wasn't on anybody's radar. So I also did a second consult with Dr. Frank Feigenbaum here in Dallas. He is a renowned Tarlov cyst surgeon, possibly even does more patients than Dr. Schroet does, even though they're both recommended. Dr. Feigenbaum has his patients undergo something called a diagnostic nerve root block at that level, and it's a very good predictor of if your Tarlov cyst is symptomatic. And so I did undergo that diagnostic nerve block, and I tell you that my reaction to that nerve root block was so extreme that I fell apart for 15 minutes and could not even compose myself for that amount of time to walk out of the office, because it took away every single pain that I had. I was able to walk. I was able to sit. That pain that I'd been trying to describe to people for all these years was absolutely like mind blowing. And it only lasts for 6 to 8 hours, the relief. But literally, I fell apart. I ugly cried for 15 minutes and just, like I said, couldn't even gather my composure to leave the office. It was so extreme. I had a follow-up with Dr. Feigenbaum and a follow-up appointment with Dr. Schroet. Ultimately decided to have this very controversial surgery. Many surgeons say it's dangerous. There can be a lot of side effects. If you get a surgeon that doesn't know what they're doing repairing a Tarlov cyst, it can cause bowel and bladder problems. It can cause all kinds of further disability, further pain. So a lot of surgeons, number one, remember, they don't even think they're symptomatic. They don't think that they can be repaired. Some surgeons try to repair them with injecting fibrin glue to basically, the cyst puts pressure on the spinal nerves, is basically how that goes. It can also cause people with Tarlov cysts. I don't know if it's a causative thing, because I'm still not the expert, just trying to save my own health here. But they can also cause, people with Tarlov cysts and connective tissue disorders can also have CSF leaks or cerebral spinal fluid leaks that cause headaches and other kinds of pain and disability. So anyway, that's all part of this Tarlov thing, which is a connective tissue thing, which is an EDS thing, which is a metal allergy thing in a lot of people. Anyway, I can't wait for the science to come out that shows the correlation on all of this. But anyway, I wound up deciding to have surgery with Dr. Schroet in California. As it turns out, Dr. Feigenbaum is an amazing surgeon who helps a ton of Tarlov cyst patients, but he uses a very small titanium clip in his Tarlov cyst repair surgeries. And even though he insists that it is pure and inert titanium, this is how he is taught by the reps. This is how he is trained. This is the dogma behind some of these surgical clips. And they don't realize, as we realize, there's no such thing. All commercially pure titanium, by and large, is an alloy. Usually it's Ti6Al4V, which is titanium, 6% aluminum, 4% vanadium, and a balance of titanium, in which this alloy contains trace amounts of nickel and other metals. We've been able to find severe reaction and sensitivity and severe symptoms manifest in the body to percentages as low as 0.013. But these trace alloys in the commercially pure titanium, they're not required to be listed by the FDA. And so they're not, and it's not part of the rep's education. It's not part of the physician's narrative. And many physicians, even though they mean well, they just cannot accept that this is a problem for their patients. This trace nickel or an allergy to trace vanadium or aluminum is causing these kind of type 4 systemic hypersensitive reactions that can cause localized reactions also. That's not to take away from how they're taught and how they're trained, but the narrative needs to change here, because we are finding more and more that patients are reacting. For me, Dr. Feigenbaum was willing to perform that surgery without the surgical clip, but he wasn't real happy about it. And he felt like that was going back to the ice ages for how he used to do surgery. And it's not as quick, it's not as convenient because sutures have to be made when you're doing things old school. And it does take a little more time. And if you don't see that it's really causing a problem, then why are you going to inconvenience yourself? Again, Dr. Feigenbaum's a brilliant surgeon. He helps a lot of people with Tarlov cysts, but for the patients that have ever had a jewelry allergy, I recommend testing with a blood LTT test, lymphocyte transformation test, and patch testing can confirm as well for metal hypersensitivity. And if there's any question, I do recommend having a surgery that leaves no permanent metal in your body. Now, Dr. Schroet was extremely friendly to the possibility of metal hypersensitivity causing severe systemic reactions, as I had proven in me they had. He uses a different technique. He opens the sacral bone and uses small craniofacial microplates and screws to close the sacral bone, and does not use a clip in the repair of the Tarlov cyst surgery. How he does that surgery is he basically drains the cyst and he wraps it with a synthetic material, and he does not use the clip there. And then he closes the opening in the back of the sacral bone with a certain number of microplates and screws. And once the bone heals, those can be removed in their entirety, but it does require a completely separate surgery. So we decided, and Dr. Schroet was very good to meet with, Dr. Scott Schroeder, as you know, who lectures surgeons worldwide on systemic metal hypersensitivity. And that conversation went very well. And Dr. Schroet, I think, will turn out to be a huge advocate for those in the metal allergic community that need spine and brain surgery and Tarlov cyst surgery and coccyx removal surgery, although that doesn't use metal. But anyway, we tried very hard to find hardware that was maybe carbon fiber coated or something that would not necessitate a second surgery. We were unsuccessful, but I did need the surgery. It was going to be what was restoring my ability to walk and sit and stand, most likely. So the benefit for me definitely outweighed the risk of the surgery. And here I've had, all these surgeries to remove metal, so the metal burden in my body was much less. We got a hold of the manufacturer reps ahead of time and found out that the hardware that he was going to use did not have any constitutional nickel, although I knew, because I'm experienced at this point, that Ti6Al4V usually has some kind of trace nickel. But I've had so much metal removed, maybe the body burden is enough that I'm not going to react to that, and we can go take it out, which we scheduled at the time I had my Tarlov cyst surgery. So cutting to the chase, I went and had this Tarlov cyst surgery with this master Tarlov cyst repair guy, and it did restore my ability to walk, sit, and stand. I can now walk 8 to 10 miles a day. I don't have trouble sitting. It took away much of the heaviness in my legs, not all. There's another story there. Those cysts were repaired. Those little 1 centimeter, barely, they weren't even 1 centimeter, cysts were the cause. And I believe it was the fall with my Great Dane that made them become symptomatic. I felt very, very much led through a series of non-coincidental coincidences to Dr. Schroet, first to remove the hypermobile coccyx, and then second to repair the Tarlov cysts. And wow, it just goes to show that's a thing, because it was night and day. The minute my surgery was over, the narrative needs to change on Tarlov cysts, no matter what size. There are thoracic and other Tarlov cysts up and down the spinal cord, and I guarantee you they're causing pain and symptoms for a lot of people. We need a lot more doctors. We need a lot more surgeons trained to recognize these cysts and to be trained in this procedure, because somebody may not be able to walk, sit, or stand because of what the cyst is doing on the nerve roots in their sacrum. So I'm very grateful for Dr. Schroet. I'm grateful for these great doctors that are championing these techniques to repair these Tarlov cysts. I wanted to add that on the Tarlov cyst surgery, I was thinking that the metal burden was lighter in my body, so perhaps I wouldn't have symptoms from the little microplates and screws. They were teeny, y'all. The little plates were the size of the white line on my fingernail. That's how big these little metal plates were. And the screws were even tinier, microscopic plates and screws.
And now, a word from our sponsor. Attention metalheads, are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit meliza.org to learn more and schedule your test. Trust us, you'll be glad you did. Meliza, a valuable diagnostic tool in medicine.
I was fine after surgery, after my Tarlov cyst repair, for about 4 months. And in true delayed hypersensitivity reaction fashion, I became reactive to those surgical plates about 4 months after surgery. I showed with a lot of fatigue, massive fatigue, and brain fog. I couldn't do math in my head anymore, and a lot more systemic pain. Before the Tarlov cyst surgery, I'd been able to get down to half an Allegra once a day instead of 3 Allegra every day. That's how far down my histamine load had come. And I was doing really great with the systemic pain and no problem. And all of a sudden, 4 months later, I had the pain, I had the fatigue, I had the brain fog, and I had to go back to 3 Allegra a day. But when I finally realized what it was, it just hit me out of nowhere. I'm like, oh my gosh, that's what this is. I'm reacting to the plates and screws after all. And for anybody who's skeptical, all of that went away completely 3 months later when I had the plates and screws removed. Like literally overnight, again, same thing, back to half an antihistamine a day. I could do math in my head again. The brain fog was gone. The pain was gone. So, I mean, I've done my own double-blind studies. I am my own peer review study. It was crazy because I wasn't even looking for it. And the interesting thing is, and I'll stick it up here, I had another orthopedic analysis test for metal after my Tarlov cyst surgery, but before the plates were taken out and before I was symptomatic from the plates being put in. And I couldn't figure out why my nickel that had been like a 6.7 on the first orthopedic analysis test was now showing reactive at like 12.2 or 12.4. It had doubled. And orthopedic analysis doesn't believe me, but my theory is my immune system was reacting to the new nickel before I even experienced outward symptoms, which is crazy. So I need to go back and test again now that that's all out. After I had my Tarlov cyst repaired, I was able to go in and have removal of my cervical plate at C6-7 that had been put in. If you haven't seen episode 2, I had a cervical fusion surgery with materials that I was allergic to, and that was a non-union. That cervical segment collapsed and we had to revise that surgery. We did have to use a metal plate, and a year later I was able to go get that taken out. That came, I believe, after my Tarlov surgery. So I've had the Tarlov surgery, I've had that plate removed, and then you'll notice that I slowed down a lot since the end of 24 to now. It's been a little bit difficult. In March of 2024, my mother passed away due to breast cancer, metastatic breast cancer. And that was very, very difficult for me. And I'm the one that had to settle her estate. And I take summers off anyway from the podcast. That was a really, really hard, emotional, and crazy time. And I was still undergoing recovery from my Tarlov cyst surgery and from the removal of my cervical plate. So that happened. As I got a ton better, I was still having a lot of heaviness and pain in my legs that just, even though it was way, way better and I could now walk, sit, and stand, it just wasn't normal. I had a conversation with my mom when she was on hospice, and I said, Mom, when you die, I need you to go beg God and ask him what's wrong with my legs, because we've done all these things. We've removed my lumbar hardware, we've addressed my SI joints, we've removed my tailbone, we've repaired my Tarlov cyst, and my legs still feel heavy and not normal. And I said, I need you to go beg God and ask him what's wrong with my legs because we're missing something. And long story short, she did that because not long after she passed away, I'm scrolling on Facebook, as I do, and I'm on the EDS page, and I come on a post that says something to the effect of the Ehlers Danlos Society would like to partner with the Lipedema Foundation to bring awareness to lipedema, which affects 11% of women worldwide. And had a picture of my mom's legs, not literally my mom's legs, but legs that looked exactly like my mom's. And I'd never seen legs that looked like this anywhere. So what's lipedema? I'm going to go back and unpack this. So you know those girls with the thick thighs, really small waist, a little larger in the butt, a little larger in the hip, larger in the thighs. Look like we have a little cellulite, maybe a little more cellulite than normal, or a lot more cellulite than normal. This is lipedema. Lipedema is a connective tissue disease. Most doctors confuse it with lymphedema. It is not lymphedema. It's kind of a cousin, but it's not related. Lipedema is very common in people with connective tissue diseases like EDS. I'm also finding that lipedema is very common in a large percentage of people with metal hypersensitivity. It usually only affects females. Men carry the gene, but they don't often express it. It is expressed in a few men, but not very regularly. I've always been kind of thick on the thighs. I've always been that girl that had way more cellulite and was just embarrassed and thought it ran in my family. And lipedema is diet resistant, it's weight loss resistant, and it's bariatric surgery resistant. So you can lose your normal adipose tissue and fat, but not your lipedema fat. And I'll put some pictures up here so you can see what lipedema looks like. I'll put these up from the Lipedema Foundation. And if I'm brave enough here, I'll go ahead and show you what my legs look like. And it causes heaviness. The cellulite is in fact not cellulite. It's hard fibrotic adipose tissue. Basically, lipedema is a fat storage disorder. It's really hard fibrotic adipose tissue, and it stores toxins. We believe it stores metals. Actually, my lipedema surgeon's theory, and we'll get to that in a minute, is that perhaps it's hard for women with lipedema to lose weight because many of them are allergic to metal, and the body is protecting itself from bringing the metal back into the body. Our bodies are intelligent and smart. Now, that has not been proven. It's just a working kind of hypothesis that we're exploring, and why not? It doesn't usually affect the hands or feet. It causes swelling bilaterally. People with lipedema also bruise really easily. Bruise and swell and can't lose weight. And like I said, look like they have a ton of cellulite. I knew it was me the minute I saw it. And my mom was the kindest woman I ever knew. She was born really thin. She was 124 pounds the day she had me. She always had a thigh gap. Like, she was a thin person, but lipedema blooms during puberty, menopause, and pregnancy, and it can become really, really aggressive during those times. It's thought to be fed by hormones. It's a clinical diagnosis. As yet, there's no test for lipedema, but I knew I had lipedema immediately. I bruise all the time. I always had like 5 or 6 bruises on my legs, no matter what, and super, super heavy, super painful. And I knew immediately that I had lipedema, and I knew that mom went and talked to God and found out what was wrong with my legs. And what followed is I was rapidly diagnosed. There are conservative measures that work for lipedema. There's compression, manual lymphatic drainage massage, exercises like vibration plates and rebounding and swimming and things that are really good for the lymphatics if you're not disabled and can do those things. But lipedema is progressive and will take your mobility. It took my mom's mobility at age 60. We didn't know she had it. And bless her heart, she got up to 318 pounds at one point. And she always had a small waist, but really, really large hips and disproportionate hips and thighs. And now there are people that have the more column leg look, and they have a cuff of fat at the ankle and sometimes at the wrist, and it's more of a column look to the legs. My mom didn't have that particular type of lipedema. She had the type where the bottom of her legs were small. It was her thighs and her hips and her bum that was like super, super large. And even though her waist was smaller, and her stomach was disproportionately large also, she had lipedema in the abdomen. She lost her mobility at age 60. She also, I believe, had a metal allergy to a plate in her lower legs, and I believe it caused a lot of her rheumatology type symptoms. That has not been able to be confirmed because she's now gone. But she kept having non-healing wounds, cellulitis on the bottom part of her legs. Again, circulation of people with lipedema. 85% have problems with their veins. 100% have lymphatic problems. And anyway, I knew by the picture of a stage 3.5, 4 lipedema patient that was that body type, same as my mom. I'd never seen anything like it. I knew immediately when I saw the picture on the EDS thing that I had lipedema, and it was the rest of the story. I was diagnosed, and I knew conservative measures weren't going to work because I was having too much pain. And for people who have failed at conservative measures or who desire to take it a step further, the answer is lipedema removal surgery, which is a highly specialized liposuction that avoids impairing and impacting the lymphatic system and spares the lymph system so that it can function correctly. And long story short, this year, starting in January, I had a surgery in January, May, and September to remove lipedema from my body. And basically, let me add here, I have had, my first surgery was 10.5 liters of lipedema tissue. My second surgery was 8.5 liters, and my third surgery was over 8 liters. And I have now had lipedema removed from basically my entire body except for my breasts and my face. And I believe I have lipedema in my head because I've always been like crazy tender-headed. 5% of patients with lipedema can have lipedema in their head. You can't do anything for that, I don't think. Can't do liposuction to the head, my hairdresser asked. But I just recently, in September, had my arms done. I have like little bitty skinny arms. This is why I'm in this compression. I had my arms, my stomach, my butt, hips, thighs, top to bottom, had lipedema tissue removed from all of those areas. We found lipomas. We found very, very difficult, hard, fibrotic, nasty tissue, and I'm feeling a lot better. I'm super thin, but we didn't do it for aesthetics. We did it for disease. This is a disease that will take mobility, and my mom had to have 2 new hips, 2 new knees. I can't have those implants ever due to my systemic metal hypersensitivity. I chose to go to Greece for my lipedema surgery. There are some good surgeons in the US, but the US isn't as progressed in research and surgery as Europe is. The best lipedema surgeons are in Germany, and over in Europe, they remove a greater percentage of the lipedema safely. If you can remove 85% of the lipedema, the chance for regrowth is much less. And it is also much less costly to have lipedema surgery in Greece. My surgery in Greece for going and staying for 2 weeks, taking somebody, which included doctor, hospital, lodging, sightseeing, like I said, taking a companion, my manual lymphatic drainage massage, hospital anesthesia, surgeon, the whole 9 yards, it wound up to be about $15,000 per surgery, as opposed to one surgery here in the US can be upwards of $30,000. And if they take half as much and you need twice as many, well, that just doesn't math really well. I'm very fortunate that I was able to have that surgery. It did not come without sacrifice. I had to mortgage a house to do it. I don't have that kind of money laying around, like you guys don't have that kind of money laying around, but I'm 58 years old, and the quality of my life and my future mobility depended on having these surgeries. So I chose to do that. It is liposuction and in some places skin removal. I had that to my stomach, but due to the liposuction in my abdomen. And these surgeries are very, very difficult to recover from. They're very painful. It looks like you've been beaten black and blue with a baseball bat. You have to have manual lymphatic massages every day for a couple of weeks. And then for months afterward, you have to wear this horrible compression. So it is a process. So I've basically undergone this 12-week process 3 times this year, with traveling an hour each way for these manual lymphatic drainage massages and traveling back and forth to Greece 3 times, plus a 4th for a vacation that we had booked before I even knew I needed surgery in Greece. And I was able to walk 10 miles a day on that surgery. So that was like, we know that everything really has worked. But I do need to apologize because I have not been as much on my game with the podcast as I would have liked to have been. I was a little slow leading up to the summer because of the surgeries, and then I took my summer off, and I had a couple episodes in the can, but I had some technical difficulties, and it's been kind of a slower start back this fall than I had wanted. So I thought that this episode would be really good to let you know why. But as it turns out, I think this is going to make a big difference for our community because many in the Tarlov cyst community have metal allergies. Many in the lipedema community have metal allergies and have had other surgeries. People with EDS have pain, and people with Tarlov have pain, and people with lipedema have pain, and it's this systemic pain. And connective tissue diseases really are the umbrella for a lot of these syndromes like lipedema and Tarlov cyst disease. It's crazy. And I have a great surgeon in Greece for my lipedema, Dr. Apostolos Siafliakis. Say that 3 times fast. He is incredible. And we're actually testing my extracted lipedema fat for metals, not only for the common metals like nickel, vanadium, chromium, cobalt, but we are also testing for gadolinium because we know that I have over 200 times the highest safe amount of gadolinium in my body. Gadolinium is a toxic rare earth metal that is a metallic based MRI contrast. So if you get an MRI with contrast, that contrast is gadolinium. It's injected. I need to bring my friend Debbie Lambert back on with Living with Gadolinium LLC. You can go watch that podcast, but it's injected tens of thousands of times annually. It is not excreted by the body. It's retained in every single person it's injected into. She can tell you that. And it causes pain and all kinds of problems, cancer, side effects. Gadolinium is a big deal. There's an FDA black box warning that everybody is supposed to be given before they have gadolinium injected. And either they're not giving it, which is my bet, or patients aren't reading it, or some of both. But gadolinium is a big deal. It's a metal. So anybody with a metal allergy, people with metal allergies are often cross-reactive to many metals. Gadolinium could be one of them. Yeah. So that's what's going on with me. That's the rest of the story. I hope it's the rest of the story. I'm currently undergoing EMDR therapy for my medical PTSD because, oh my gosh, there's been a lot. It is now 48 surgeries, y'all. And I think I have to go back for probably a few skin lifts for the loose skin on my thighs and under my arms from having the lipedema removed. And a big caution to anybody with lipedema, if you're going back for lifts, many people are having skin lifts and breast reduction and breast lifts and revision surgeries, things like that. If you have lipedema and you have a metal allergy, you need to be very proactive in asking your doctors if they're using surgical clips and staples. They use them very routinely these days, often under the standard of care without patient consent. Very, very important for anybody having a surgery to talk about surgical clips and staples because they often fly under the radar. And, we've also talked about those little biopsy markers that they put in your breast when they're doing biopsies and potentially in other places. So that is still a very, very important conversation. I still have a lot of great things in store. There are some things in the works that I can't talk about yet for heavily metalled. Still going to be coming out with the metal allergy course. It's been very slow rolling out just because, honestly, y'all, it has been a lot between the death of my mom. My son also got married last September, my only son, and that was very quick. So it's just been a lot. Basically, between the Tarlov surgery, the cervical surgery, and the lipedema surgeries, it has been 5 more surgeries in the last 2-year period. Except for potentially some lifts. I don't think there's another surgery in my future. I hope not. And I'm working hard to bring you new patient stories and new episodes, and with more regular frequency as we move on here. I just honestly needed a minute. This podcast is a labor of love for me. I don't make money doing it. I spend money doing it, and it requires time and energy and money. By the way, if you would like to help heavily metalled and you have time that you can volunteer or you want to intern to help with social media, to help with community outreach, to help with PR publicity, or to help with editing the podcast, I would be very, very much open to receiving some volunteer hours and internship hours. I'm just one person trying to change the world, and it takes a village. So I appreciate you being part of that village, and I'm very, very grateful for your part in my journey and your part to like, share, and comment on all the posts and send people to the podcast and to the resource pages. And if I haven't responded to your email and I haven't responded to you reaching out, I apologize. Like I said, I'm just one person and I work 13 to 14 hours a day, and literally I'm exhausted. This is just exhausting, the whole thing. But I'm here for you and trying to be here for me and my family also. It's a balance thing. So I appreciate your understanding, and as always, encourage you to go visit heavilymetalled.com, check out the resource pages for lots of resources and helps that you can use, things like the low nickel diet, the low nickel diet cookbook, how to test for metal allergies in the blood, and some support groups that are widely available. We need more, but I really appreciate it. We have a petition there that you can sign and carry to your medical providers, your offices, your facilities, your hospitals, to urge them to pre-screen for metal allergies and to test ahead of time, ahead of surgery and ahead of admission for metal hypersensitivity, because it can make a really big difference. I'd like to urge you to go sign the petition to urge doctors and hospitals and facilities to test their patients ahead of time for metal hypersensitivity, to make this a routine screening. We need to continue to shout from the rooftops and to all of our providers and to the world that we just are not going to take this anymore.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants, and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware, and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetalled.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.